All right, future EMTs. Welcome to the deep dive. You ready to crack open some seriously important knowledge about trauma?
You bet. We're going to make those textbooks come to life.
Exactly. You know, I was thinking about this. You're out there, lights flashing, sirens, the whole 9 yards.
Yeah.
And every second counts right.
Oh, absolutely.
But figuring out what really happened, that's where it gets tricky. That's where this deep dive comes in.
Think of it this way. You're not just treating, like, a broken leg or something. You're piecing together how that leg got broken.
Oh, I like that, like a puzzle.
Yeah. And
Here.
what else might be broken that you can't even see yet?
Right. Hidden injuries, that's super important. So you sent me a bunch of articles on this, and we've got stuff on energy transfer.
Mm-hmm.
The difference between blunt and penetrating trauma
Yeah.
and, you know, those crazy physics of car crashes.
Yeah.
Like how those can cause, well, really unexpected injuries.
It's wild, right?
It is. And, you know, I was blown away by this fact. Trauma is the leading cause of death for people under 44.
Yeah, it's a big deal.
It is. So let's break it down. First up, energy. I mean, it's everywhere, right?
Sure is.
But it's not always a good thing.
Nope. And that's where understanding some basic physics can really come in handy in the field.
Okay, so Physics 101 for EMTs. I'm in.
Perfect. Let's start with kinetic energy.
Right.
Energy of motion, right?
Okay.
So picture a speeding car.
Okay, got it.
The faster it goes, the more kinetic energy it has.
Okay.
And when that car hits something, all that energy has to go somewhere.
So it's not just about the size of the car then.
Right.
It's about how fast it's moving too.
Exactly. Deadly combination of mass and velocity.
Oh, I see.
Now imagine someone falling from a height, you know?
Okay.
That's potential energy in action. Higher the fall, the more potential energy.
Right.
And that all gets converted into force when they hit the ground.
That makes sense.
So it's about the work that energy does to the body, not just the energy itself.
The work.
Yeah, like in physics, work means force acting over a distance. So think of it as the damage done when that energy has to stop suddenly.
Got it.
Bones break, organs can tear, all that stuff.
That's a powerful way to think about it.
It is. So even two people falling from the same height,
Yeah.
they could have totally different injuries depending on how they land, what they hit.
Makes sense.
Yeah.
All right, well, let's switch gears for a second. Talk about blunt versus penetrating trauma.
Okay, good one.
So, I mean, blunt trauma, something hits you.
Right.
Penetrating something pierces you. Pretty straightforward, right?
Be careful. Both can be super dangerous. And what you see on the outside, well, it doesn't always tell the whole story.
Oh, I see, I see.
So imagine someone gets hit with a baseball bat,
Okay.
even if their skin isn't broken, you know?
Yeah.
That blunt force can do damage inside, bleeding, organ damage, even concussions.
It's like a hidden danger.
It is. It is.
Okay, well, what about penetrating trauma then? I mean, it seems like that would be more obvious.
Not necessarily. Think about a stabbing.
Yeah.
The entry wound might be small.
Okay. But inside, who knows? It could have sliced through important stuff. Blood vessels.
So as EMTs, we've got to be, like, suspicious, not just focus on what we see.
All the time. What you don't see is what can really get you.
I got it. Okay, well, are you ready to tackle one of the most common
Let's do it.
and complex mechanisms of injury? Let's talk car crashes.
All right, buckle up.
I've heard about this 3 collisions concept.
Oh, yeah.
Can you break it down for us like we're back in EMT class?
Absolutely. So the 3 collisions concept helps explain why even like those little fender benders
Yeah.
can be way worse than they look.
Okay.
First collision is the obvious one, car versus whatever it hit.
Right.
So you look at the damage to the car,
Okay.
crumpled metal, shattered glass, those are clues.
So the more messed up the car is, the more likely the passengers are messed up too.
Yeah, that's a good way to think about it.
Okay.
But there's more. Second collision, it's passenger versus car interior.
Okay, so that's where the seatbelts and airbags come in.
You got it. But those can cause injuries too, right?
They can.
Kind of ironic.
It is. Seatbelts, for instance, they can cause hip dislocations if they're worn too low.
Oh, wow.
And airbags can cause burns or even broken arms sometimes.
I guess it's all about how the body interacts with those safety features.
It is all about the physics.
Okay, that's 2 collisions. What's the third?
This is where it gets scary. It's the collision we can't see. Organs versus body.
Oh.
So imagine the brain hitting the skull, the aorta tearing.
Oh, wow.
All from that sudden stop. This is the silent but deadly part of a crash.
Someone could look okay on the outside, but have all this stuff going on inside.
Exactly.
Yeah.
That's why understanding those 3 collisions is so important. Helps you anticipate those unseen injuries.
Got it. All right, so we've got those 3 collisions, but different types of crashes, like head-on or rollovers.
Right.
Those must have their own kind of injuries, right?
Right.
Can we do a quick crash course on those?
Of course. Let's start with frontal crashes. Remember those supplemental restraint systems?
Airbags and seatbelts.
Yeah. Airbags can save your life, but they can also cause burns or fractures, and seatbelts can cause problems with the hips and abdomen.
Got it. Always check those restraints.
Yeah.
What about rear-end collisions?
Think whiplash. Neck injuries are a big one, and believe it or not, even at low speeds, brain injuries are possible.
So even fender benders can be dangerous.
They can. Now, what about T-bone collisions?
Those seem really bad.
They can be. The chest and abdomen are very vulnerable in T-bone crashes.
So ribs, lungs, all that stuff.
You got it. Now, rollovers, those are the wildest.
What makes those so bad?
Well, they're the most unpredictable, multiple impacts. The biggest risk is being ejected from the vehicle.
Right, if you're not wearing a seatbelt.
Exactly. But even with a seatbelt, rollovers are dangerous. Spinal injuries are a big concern.
Okay, so with rollovers, we're basically expecting the unexpected.
You got it. Now let's go beyond cars for a minute. What about falls, bike crashes, motorcycle accidents? Each of those has its own set of challenges.
All right, let's start with falls. Seems like the height of the fall would be the most important thing.
It's important, but it's not the whole story. You also have to think about what part of the body hits first and how they land. Falling on your feet can actually lead to spinal injuries.
So even a simple fall can be tricky.
It can. Now, car versus bicycle.
Okay,
Always suspect a spinal injury there, even with a helmet.
right. Helmets protect the head, but not the neck.
Exactly. And look at the bike itself. The damage can tell you a lot about the forces involved.
Makes sense.
And motorcycles.
Helmets are crucial, but again, they don't protect everything. The type of impact makes a difference.
So, just like car crashes, we're looking at multiple impacts.
You got it. Now, are you ready for a real challenge?
Hit me with it.
Let's talk about blast injuries.
Oh, bring on the boom.
Blast injuries are tricky. They involve 4 different mechanisms, and patients often experience a combination of them.
Okay, 4 mechanisms. First one, primary blast injury, is caused by the pressure wave itself. Invisible but incredibly destructive, especially to the lungs.
So someone could be standing near an explosion and have serious internal damage even if they weren't hit by anything.
That's right. It's the shock wave that does the damage, not necessarily the shrapnel or debris. Then you have secondary blast injuries caused by those flying objects, shrapnel, glass, anything that gets propelled by the blast.
Okay, so those are the ones we usually think about with explosions.
Right, those injuries are more obvious, but you still have to consider the potential for internal damage.
Makes sense. Okay, what about the other 2 mechanisms?
Well, tertiary blast injuries happen when the blast wave throws the victim against something. Basically blunt force trauma, just like a fall from a height.
So like they were ejected.
Exactly.
Yeah.
And lastly, we have quaternary injuries, the everything else category. Burns, toxic gas inhalation, crush injuries, you name it.
Wow, that's a lot. So blast injuries are super complex. What are some things we should be looking for when assessing a blast victim?
One of the first things to check is the eardrums.
Eardrums.
Yeah, ruptured eardrums are common in blast victims, and they can actually indicate potential lung injury from that initial pressure wave.
So something as small as a ruptured eardrum could be a sign of something much more serious.
Exactly. You also want to look for any signs of respiratory distress, difficulty breathing, coughing up blood, unusual breathing rate.
So we're looking for any sign of lung injury.
Yes. And don't forget about the abdomen. That pressure wave can rupture the organs in there, which can lead to internal bleeding and infection.
So even if there aren't any obvious external injuries, we're still checking the abdomen.
Absolutely. And if there's any indication of abdominal injury, rapid transport to a trauma center is critical.
Got it. Wow. This is a lot of information, but it's incredibly valuable.
Sure.
I feel like I'm already more prepared for my EMT rotations thanks to this deep dive.
That's great to hear. And remember, this is just the beginning when it comes to trauma. But by understanding those mechanisms of injury, you'll be able to provide the best care for your patients. Now that we've gone over those common mechanisms, let's switch gears a bit and talk about penetrating trauma.
Penetrating trauma. Okay. We talked about the difference between blunt and penetrating earlier.
Yeah.
But I have a feeling there's more to it when you're actually at the scene.
Oh, yeah, absolutely. With penetrating trauma, it's not just about the wound you see. We have to think about what caused it, how fast it was going,
Okay.
and its path inside the body.
So like a knife wound is different from a gunshot wound.
Exactly. The amount of energy that gets transferred to the body depends on the object's mass and velocity. A low-velocity object, like a knife, it'll mainly cause damage along its path. But a high-velocity projectile, like a bullet, can create a shockwave.
Okay.
And that shockwave can cause damage way beyond the actual bullet's path.
That's where cavitation comes in, right? We talked about that with blast injuries.
You got it. Cavitation, it's like imagine dropping a pebble in a pond and you see that ripple effect.
Yeah.
That's kind of what happens with a high-velocity projectile. It creates a cavity, and that can damage tissues and organs, even the ones that weren't directly hit.
So a tiny entry wound could mean massive internal damage.
Exactly. So you have to consider the type of weapon, the circumstances when you're assessing penetrating trauma. Never underestimate the unseen damage.
Okay, so what should we be looking for with penetrating trauma?
First, how many injuries are there? Try to find the entrance and exit wounds.
If there are any.
Right, it can be tricky, especially with gunshots. Bullets can ricochet, break apart inside the body.
So it's not always a straight line.
Nope, not always. And remember, the exit wound is often bigger than the entry wound because of that cavitation.
Okay, so entry and exit wounds, the path of the object, and keeping in mind that internal damage could be way worse. What else?
Well, infection is a big concern with penetrating trauma. So controlling bleeding, dressing those wounds properly, getting them to a hospital, those are your priorities.
Got it. Infection control and rapid transport. Now, we've talked about the physical side of trauma, but there's got to be a psychological side to this too, right?
Yeah.
For the EMTs, I mean, we're not robots.
You're absolutely right. Seeing those injuries, especially severe ones, it can take a toll on anyone. It's not something you just forget about.
Yeah, it's not like watching a movie. This is real life.
Exactly. It's important to take care of your mental health, be proactive about it.
So self-care isn't just some buzzword. It's important for EMTs too.
It is. Don't bottle things up. Talk to someone you trust, your partner, supervisor, a counselor.
Okay, communication is key. What else can help?
The basics are important. Sleep, healthy food, exercise, and relaxation techniques like deep breathing or meditation.
The putting on your own oxygen mask first.
Exactly. And if you're struggling, reach out for help. There are resources available. There's no shame in asking.
That's good to know. It's easy to forget about taking care of yourself when you're focused on the job. But I guess our well-being is essential if we want to be good EMTs.
Absolutely. Now, let's think about the psychological impact on the patient. We've talked about physical injuries, but what about the emotional and mental toll?
Trauma can be terrifying, disorienting. They're in pain, confused, scared.
It's not just about the physical injury. Their whole experience before, during, and after the event, it all impacts them.
So as EMTs, we need to be sensitive to that.
Exactly. A calm, empathetic approach can make a huge difference. Communicate clearly, answer their questions honestly.
Just being present, listening, that can be really important too.
It is. It's about connecting with them as human beings. Now let's dive into blast injuries a bit more.
Blast injuries, all right. We touched on them earlier, but I'm ready to go deeper into that explosive world. What makes them so different from other types of trauma?
Blast injuries are a whole different ballgame. They can cause such a wide range of injuries, and some of them you might not see right away.
You mentioned 4 mechanisms of blast injury. Can you go over those again?
Sure. First, primary blast injuries. Those are caused by the pressure wave. This pressure wave can be really damaging, especially to organs like the lungs, eardrums, even the intestines.
So even without any visible injury, someone could have serious internal damage just from the pressure.
Exactly. Then there's secondary blast injuries. Those are caused by the flying debris, the shrapnel, glass, anything propelled by the blast.
Okay, so those are the ones that are usually more visible.
Right, but you still need to think about possible internal injuries.
Got it. What about the other 2?
Tertiary blast injuries, these happen when the blast wave throws the victim against something, so it's like blunt force trauma, like falling from a height.
Okay.
And lastly, quaternary blast injuries, this is the everything else category. Burns, crush injuries, toxic inhalation, even radiation exposure.
Wow. Okay, so blast injuries are incredibly complex. Where do we even begin when assessing a blast victim?
Scene safety first, always. Make sure it's safe for you, your partner, and the patient.
Of course, safety first.
Once you know the scene is safe, focus on the ABCs, airway, breathing, circulation, just like with any trauma patient.
Right, those are always the top priorities.
Exactly. And while you're checking those, be thinking about potential life threats, how you'll manage them.
Like uncontrolled bleeding, collapsed lung, things like that.
Yes, those are the things that can kill a patient quickly. You have to be ready to act fast.
Okay.
Now remember, with blast injuries, ruptured eardrums are common. And that can indicate potential lung injury from the pressure wave.
So always check the ears.
Always. Also, watch out for any signs of respiratory distress, difficulty breathing, coughing up blood, unusual breathing rate, chest pain.
So any sign of lung injury is a big red flag.
It is. And don't forget about the possibility of abdominal injury.
Right, that pressure wave can do damage to those organs.
Exactly. So palpate the abdomen, check for any tenderness or rigidity, and if there's any sign of abdominal injury, they need to get to a trauma center fast. Now, transporting a blast victim, ideally you want to take them to a trauma center that has experience with blast injuries.
So not just the closest one, but the one that's best equipped to handle this kind of trauma.
That's right. And communicate with the hospital early, let them know what to expect.
Okay, good communication is key.
It is. Now, let's zoom out a bit and think about trauma care as a whole. What are the most important things for you as future EMTs to remember?
Big picture time, all right. Lay it on me.
Well, trauma is unpredictable, it's not always straightforward, and things can change fast.
You never know what you're going to find when you arrive on scene.
Exactly. So be prepared for anything. That means understanding those mechanisms of injury, knowing how to assess and prioritize, and being able to manage a wide range of injury.
Right, we have to think on our feet.
You do. And don't forget the human element of trauma care.
What do you mean by that?
Remember that you're caring for people in crisis. They're scared, they're hurting. Be calm, be empathetic.
Right, it's not just about treating the injuries, it's about treating the person.
Exactly. Now let's talk about golden hour.
The golden hour, okay. I've heard that term a lot.
It refers to that first hour after a traumatic injury. That time is critical. Rapid assessment, resuscitation, and getting them to definitive care, those things can make all the difference.
So it's about getting them to the hospital as fast as possible.
Speed is important, but it's not just about that. It's about providing the right care at the right time. Every decision matters.
So we need to be fast, but also careful and thoughtful.
Exactly. We have to work quickly, but also smartly. Assess the injuries, manage life-threatening issues, and communicate clearly with the hospital.
Okay, so the golden hour is like a race against time, but we also have to be strategic.
That's a great way to put it. Now, let's think about the different phases of trauma care. There's pre-hospital, hospital, and rehabilitation.
Pre-hospital, that's our domain, is EMTs. What's our main role there?
Stabilize the patient and transport them to the right facility as quickly and safely as possible. That means everything we've been talking about. Scene assessment, managing those life threats, providing supportive care.
Right, we're the first link in the chain.
Exactly. Then there's the hospital phase. That's where definitive care happens, surgery, intensive care, all that.
And we set them up for success.
That's right. And then there's the rehabilitation phase, which is important but often overlooked. This is where the patient starts to recover, and it can be a long road.
Physical therapy, counseling, all that.
Yes, it's about helping them get back to their lives, adjust to any changes.
Trauma can have a lasting impact.
It can. And as EMTs, you're a crucial part of that journey.
We're the first responders, the first people they see.
Exactly. Now let's talk about triage.
Triage, that's about sorting patients based on how badly they're hurt, right?
Exactly. It's especially important when you have lots of patients and limited resources. You have to make sure you're helping the most people you can.
It sounds stressful.
It can be, but it's necessary. The goal is to do the greatest good for the greatest number of people. So you prioritize the patients with the most serious injuries who have the best chance of survival.
Okay, so how do we do that?
One common system is START triage, which stands for Simple Triage and Rapid Treatment. It's designed to be fast and efficient.
Okay.
You focus on their breathing, circulation, and mental status, and you categorize them into 4 groups: red, yellow, green, or black.
Red is immediate, yellow can wait, green is minor, and black is, well, not good.
That's right. START triage lets you assess a lot of patients quickly and use your resources effectively.
It's like organized chaos.
That's a good way to think about it. Now, before we move on, I want to emphasize something really important: teamwork.
Teamwork. It seems obvious, but I bet there's more to it than just everyone doing their job.
You're right. Effective trauma care needs good communication and coordination between everyone involved, on scene and at the hospital.
So everyone working together, making decisions together, communicating clearly.
Exactly. And it's not just the EMTs and the doctors, it's the dispatchers, the police, the hospital staff, even the patient's family.
Wow. It really does take a village.
It does. And you, as EMTs, are a crucial part of that village. Your skills and compassion can make a real difference. Now, are you ready for some practical tips for managing trauma scenes?
Absolutely. I want to know how to stay calm and in control in those situations.
Well, the first thing to remember is scene safety. Always.
Right, that's always priority number one.
It means more than just avoiding obvious dangers like traffic or downed power lines. You also need to be aware of potential violence, chemical spills, things like that.
So be observant. Use all your senses, don't assume anything.
Exactly. Once you've made sure the scene is safe, take a moment to gather information. Don't just rush in.
Okay, so information gathering is important. What kind of information are we looking for?
Talk to anyone who might know what happened, bystanders, witnesses. They might have seen how the injury happened.
I see we're playing detective.
That's right. And while you're gathering information, also assess your resources. Do you have enough people? Do you need to call for backup?
Right, make sure you have what you need to handle the situation.
Exactly. Once you have a good understanding of what's going on and what resources you have, you can start to make a plan.
Okay, so we've got scene safety, information gathering, and planning. What's next?
Now you can approach the patient and start your assessment, but remember, you're interacting with a person who's probably scared and in pain.
Right. Treat them with respect and compassion.
Introduce yourself, explain what you're doing, get their consent if you can, let them know you're there to help.
So build rapport from the beginning.
Exactly. And as you start your assessment, remember your ABCs: airway, breathing, circulation.
Right, those are always the top priority.
They are, and while you're checking those, be thinking about potential life threats.
Like uncontrolled bleeding or a blocked airway.
Exactly. Those are the things that can kill a patient quickly, so you need to be ready to intervene.
So work quickly, but also systematically.
That's a good way to put it. Once you've managed any immediate life threats, you can do a more detailed assessment.
So a head-to-toe exam.
Yes, but remember, with trauma, we always have to think about the mechanism of injury. What happened? What forces were involved?
Right, we can't just focus on what we see on the outside.
Exactly. And keep in mind that some patients might not tell you everything. They might be scared or embarrassed or under the influence.
So we have to be observant.
You do. Now, once you've finished your assessment, you need to decide about transport.
The big decision. Do they stay or do they go?
You need to consider a few things: how bad their injuries are, their overall condition, the resources you have, and what the hospitals in the area can do.
So it's a judgment call.
It is. And if you're not sure, you can always contact medical control for advice.
Okay, good to know we have backup.
You do. Now let's talk about some tips for managing critical patients during transport.
Okay, transport tips, I'm all ears.
The most important thing is to monitor the patient's condition and intervene when you need to.
So keep reassessing, watching for changes.
Exactly. And provide supportive care, pain meds, oxygen, wound care, whatever they need.
All right, we're like a mobile ICU.
That's a good way to think about it. And communication is important too. Keep the hospital updated.
Right, let her know what they're getting.
Now, here are a few other practical tips.
Okay, hit me.
First, drive safely.
Of course, don't want to add any more injuries.
Right. And second, think about the patient's comfort. If they're nauseous, open a window or give them an emesis bag.
Right, those little things can make a big difference.
They can. Now, before we move on, I want to leave you with this thought.
Okay, I'm listening.
As an EMT, you're going to see a lot of trauma. You're going to see things that will stay with you, things that might make you question things that will break your heart.
I know, it's a tough job.
It is, but it's also incredibly rewarding. You can make a real difference in people's lives.
That's what I'm hoping to do.
That's great. And remember, you're not alone. You have a team, people who understand what you're going through. Don't be afraid to ask for help.
Thanks, I appreciate that. I'm feeling a lot more prepared for this.
I'm glad to hear that. Now, one last thing before we move on. Documentation.
Documentation. I know it's important, but it feels like so much paperwork sometimes.
It can be tedious, but it's important for a few reasons.
Okay, tell me why.
First, it ensures continuity of care. The information you record will be used by the hospital staff to make decisions about the patient's care.
So everyone's on the same page.
Right. Think of it like a story. You're telling the patient's story and you want it to be accurate and complete.
Okay, that makes sense.
Second, documentation is a legal record. If there are ever any questions about the care that was provided, your notes are what people will look at.
So it protects everyone.
Exactly. And third, documentation can be used to improve the quality of care. We can look back and see what we did well and what we can do better.
So it's about learning and getting better.
Exactly. Now, here are a few things that should always be in your trauma documentation.
Okay, give me the checklist.
First, the mechanism of injury. How did it happen? What were the forces involved?
paint a picture of the event.
Exactly. Next, your assessment findings. Vitals, level of consciousness, injuries. Be specific and objective.
Just the facts?
That's right. Then, document every intervention you did and the patient's response.
Oxygen, bleeding control, medications, all of it.
Right. And finally, document any communication you had with medical control or the hospital.
Okay, a paper trail of everything we did.
Exactly. Now let's talk about communication with the patient and their family.
Communication. Okay. I know that's important in any healthcare setting, but I bet it's especially important in trauma.
You're right. Trauma patients and their families are often in shock. They're scared, confused, in pain. You need to be sensitive to that.
So we need to be empathetic and reassuring.
Exactly. Approach them with compassion and respect. Explain things clearly and honestly. And sometimes the best thing you can do is just listen.
Just be present.
Right. And don't forget about the family. Keep them informed. Answer their questions and involve them in decisions whenever possible.
Treat everyone with respect.
You got it. Now let's talk about cultural sensitivity.
Cultural sensitivity, okay. That's about understanding and respecting people from different cultures, right?
Right, exactly. And in trauma care, it's crucial for providing good care. It's not just about being politically correct, it's about making sure the patient feels understood.
Okay, I get that. But how does culture really affect how we provide care? Can you give me some examples?
Sure. Some cultures have strong beliefs about modesty or touch. A woman might not want to be examined by a man, or a patient might have certain rituals related to death.
So we need to be aware of those things and adjust our approach.
Exactly. And cultural sensitivity can actually improve the quality of care. It helps us communicate better, build trust, and make sure we're meeting the patient's needs.
So it's about being culturally competent, not just culturally aware. It's about putting that awareness into action.
That's a great way to put it. So here are a few things you can do to incorporate cultural sensitivity into your care. Start with this. Be aware of your own biases.
Our own biases, okay.
Yeah, we all have them. It's just human nature. But we need to recognize them so they don't get in the way of good care.
Right, self-awareness is important.
It is. And don't be afraid to ask questions.
Ask questions.
Yeah, if you're unsure about a patient's cultural beliefs or practices, just ask. Most people are happy to share if you ask respectfully.
So show genuine curiosity.
Exactly. And use the resources available to you. There are tons of resources out there to help you learn about different cultures and how to provide culturally sensitive care.
Like, where would we even find those?
Your hospital or EMS agency might have training, or there are websites and organizations dedicated to this kind of thing.
Okay, so there's help out there if we need it.
Absolutely. Now let's talk about another special population, kids. Pediatric patients.
Pediatric trauma, yeah. That's a whole different ballgame, right?
Yeah.
They're not just small adults.
You got it. Their bodies are still developing, so their bones are more flexible, their organs are more vulnerable, and their metabolic rates are higher. All things to keep in mind.
So an injury that might be no big deal for an adult could be really serious for a child.
Exactly. Their airways are smaller, their breathing is faster, and they have less blood volume, so they're more likely to go into shock.
Wow, okay.
Plus, you have to consider the emotional aspect. Kids might not be able to tell you what's wrong.
Right, they might not have the words for it.
Exactly. And they're probably scared, which makes it even harder. And that fear can show up in different ways. Some kids get quiet, while others might lash out.
So we have to be patient, gentle, make them feel safe.
That's exactly right. Now, what are some things to watch for when you're assessing a pediatric trauma patient? What are the red flags?
Okay, red flags for kids.
Well, remember that their vital signs are different. Their heart rates are faster, their breathing's quicker, their blood pressure is lower.
So we need to use age-appropriate charts.
Exactly. Also, pay attention to their mental status. Any changes in behavior, any lethargy, irritability, confusion, those can be early signs that something's wrong.
Okay, changes in behavior. Got it.
And don't forget, kids' bones are more flexible. They might not have obvious signs of a fracture.
So we have to palpate carefully and think about the mechanism of injury.
Precisely. Now, transport decisions. Time is critical with kids, right?
I think so, yeah.
Yeah.
That golden hour has to be even more important.
You're absolutely right. They can crash quickly, so if you suspect a serious injury, get them to a trauma center fast.
No messing around.
And if possible, a pediatric trauma center.
Those are hospitals that specialize in treating kids, right?
Yes. They have the equipment and the experts who know how to care for injured children.
So we might have to bypass a closer hospital to get to a pediatric trauma center.
You might. It's about getting them the best care possible. Now let's switch gears again and talk about geriatric patients.
Geriatric trauma. Okay. I know older adults are more fragile.
They are. As we age, our bones get weaker, our skin thins, our organs don't work as well, and our immune systems aren't as strong.
So, a minor injury for someone younger could be a big deal for an older adult.
Exactly. And a lot of older adults have other health problems too. Heart disease, diabetes, lung disease, all sorts of things that can complicate their response to trauma.
So we need to be extra careful with them.
You do. Now, here are a few things to remember when you're caring for an older adult who's been injured. First, they might not have the same obvious signs of injury that you see in younger patients.
Really?
Yeah, their bodies just don't react the same way. For example, someone with a hip fracture might not complain of much pain.
Wow, that's important to know.
It is. And second, older adults can't compensate as well for things like blood loss.
So they're more likely to go into shock.
Exactly. And they might be taking medications that affect their clotting or their response to treatment.
Right. Polypharmacy is common in older adults.
It is. Now, transport decisions. Speed is important, and you want to get them to a trauma center that's good with geriatric patients.
A trauma center that knows how to care for older adults.
Exactly. Now, before we wrap up this deep dive, I want to talk about a few principles that apply to all trauma patients. No matter their age or how they were injured, these are the things you always need to keep in mind. First, trauma is dynamic. Things can change fast. You need to be reassessing the patient constantly.
Right. Never get complacent.
Never. Second, never underestimate supportive care. Pain management, oxygen, keeping them warm, emotional support, those things make a big difference.
Okay, so it's not just about the big interventions.
Right. And third, remember that trauma care is a team effort. Everyone plays a role. The EMTs, the doctors, the nurses, the therapists, everyone working together to get the patient the best possible outcome.
It's a collaborative effort.
It is.
Yeah.
Now, one last piece of advice. Take care of yourself.
Take care of ourselves, okay?
This job is tough. You're going to see things that will stay with you. Make sure you're taking care of your physical and mental health. You can't help others if you're not taking care of yourself.
That's good advice. Thank you so much for all this information. I feel so much more prepared to handle trauma now.
That's what we're here for. Remember, you've got the knowledge, the skills, and the compassion to make a difference. Trust your instincts, use your training, and don't be afraid to ask for help.
That's great advice. Well, I think that about wraps up our deep dive into the world of trauma. Thanks to everyone for listening, and we'll see you next time.